for joining me today as we talk about the key to a healthier world. Currently, the World Health Organization estimates that 17.1 million children's lives have been saved just from the measles vaccine since the year 2000 alone. Now, most of us have, or at some point will have kids, and for those of us who choose not to have children, we'll still be exposed to them, whether that's in the general public, maybe at a friend's house, or at a family gathering. Unfortunately, unvaccinated children pose a serious risk to the general public. Luckily for us, the life-saving abilities of vaccines far outweigh any risks. As a healthcare professional, a large part of my job is to educate patients about disease prevention so that they can protect their health. And as parents, our job is to protect our children to the best of our abilities. Now, I understand that in protecting our children, we want to make sure that the things we do to protect them don't end up actually harming them. Luckily for us, vaccines have been proven to be very, very safe. One of the main concerns we hear from parents in regards to vaccines is in relation to anaphylaxis or an allergic reaction. The CDC estimates that only 1 in every 1 million cases of adverse reactions occur from anaphylaxis, which equals 0.0001% of the population. This is a very small percentage, and of that percentage, an even smaller number of that actually results in death. Another common concern we have from parents regarding vaccines going around the general public is that vaccines have been linked with an increase in SIDS, or sudden infant death syndrome. Sudden infant death syndrome is the unexplained cessation of breathing while sleeping. One important thing for us to remember here is that correlation does not equal causation. A study published by the National Institute of Health shows us that of all reported deaths in infants under 1 year, actually ended up being attributed to SIDS and not the vaccine themselves. Furthermore, what shows us that it was not the vaccines is the fact that among these cases, the occurrence of SIDS was actually lower in vaccinated populations than among the general public. Vaccines are not only safe, but they're effective, and they're important to the health and well-being of your child and all the children around them. Luckily, we've seen a huge decline in some of the world's most deadliest diseases. And one of the best attributes of vaccines, or one of the best things that we can attribute to them, is the eradication of smallpox, which occurred in 1980 when the disease was globally eradicated. Smallpox was a devastating disease that killed between 300 and 500 million people just in the 20th century. And according to the UN, we've also seen a huge decrease in tetanus-related deaths in newborns, which has dropped from 200,000 to only 49,000 per year. In addition, we've seen a decrease in polio cases globally, which have dropped from 350,000 to only 400 worldwide. In addition to that, we've seen a huge decrease to measles, which has dropped 78% around the globe from 512 cases annually to less than 122,000 annually. Now, luckily, most of us are fortunate enough that we don't remember a world that was plagued with these horrible diseases. Unfortunately, today we're seeing a rise in outbreaks of preventable disease that are killing thousands of children all over the world. And this has been largely attributed to the anti-vaccine movement, where we're seeing diseases that haven't been around in developed nations for 50 years. Now, as amazing as these achievements are with vaccines, vaccines only work if we choose to use them. One common thing we hear from people who choose not to vaccinate their children is that they don't feel their children should have to be vaccinated if all the other kids are vaccinated. Now, what they're referring to is something called herd immunity, which means that if you are in a herd of vaccinated people, or animals are in a herd of vaccinated animals, one animal who is not vaccinated won't get sick since no one else carries the disease. However, there's a couple things that contradict this thinking. First of all, herd immunity only works with communicable diseases that transfer to person. There are certain vaccine preventable diseases, such as tetanus, that we pick up from the soil and from things we touch, and they're not transferred from person to person, which means the vaccine is only effective to the person who gets that vaccine. Additionally, according to Dr. Sanda Rangani of the Oxford Medical Science Division, highly communicable diseases such as the measles require vaccination rates of 90 to 95% because they're so contagious. For example, one person infected with measles can infect 10 to 15 other people, making it one of the most easily spread diseases known to man. Currently, the CDC estimates that in California, in the 2013 to 2014 school year, only 1,000 children were medically exempt from having to receive vaccines, meaning they had a health condition that did not allow them to have a vaccine. However, there were 17,000 children who were philosophically or religiously exempt, meaning their parents chose not to vaccinate them. Despite the US declaring our country as being measles free back in the year 2000, we've unfortunately seen since the year 2010, 13 outbreaks of measles, resulting in cases of 20 or more due to the rising number of parents choosing not to vaccinate their children. The unfortunate thing about this is that the children are the ones who suffer. The evidence overwhelmingly shows that vaccines are safe, they're effective, and if we choose not to use them, children all over the world suffer grave consequences. So what I would like you to remember is that you have the power to prevent disease spread among kids all over the world. And you choosing to vaccinate your child will save the lives of the 31% of the world's population who are under the age of 18. Thank you so much.